other things, like just like what you said, you rode yesterday and now you're sore. For instance, I have a trucking company that moves cars all over. I stepped off my truck right after.
You can film any. Yeah, I was gonna say if you want to film any.
So I basically stepped off wrong and basically my knee popped and went further than it had gone before.
This was with.
It's after my knee.
Okay.
And then I was like, oh shit, I did something wrong. But then it felt better. I'm like, wow, it's more range of motion.
Oh, you broke scar tissue.
The next day.
Okay. Then it was bad.
Not so much.
Okay.
It wouldn't move. And
did it actually dislocate, or just the pain? It felt like because my buddy did that, and his actually came out, and he had to go get it, put it back in. Okay,
but I couldn't straighten it out, and it was really sore.
Right.
And I basically, would get used to something, and I thought I was better. So I have, 50 of these machines. Wasn't using it anymore because I was better. Well, that happened. I used it one time. After that happened, I was able to completely straighten my knee out. And after I did that, I was all better.
This would be exactly what I need for the day after, especially. I do it like I usually do my workouts like in the gym or whatever. I like to get 3 days of weight training, and I mostly do reps. I'm not trying to get. I don't want to get big, but I want to stay lean. At 55, I want to keep my range of motion and so forth. So 3 days of that. But what I like to do, and then I like to be on the bike 2 to 3 days a week. But this would be for me after, especially after riding. That would be amazing to be able to, like right now, the day I'm stiff, because I can't really force myself through it. There's pain, and and I'm like, okay, I can do some squats and so forth. But to be able to control it and push it and then hold it where I need to, absolutely, that would help me further my recovery.
So that's telling me, and then that's one of the questions I have as going forward with this. I'm doing my first show in New Orleans next month, and when you do the knee replacement, obviously the price is not an option because you want to get better.
Right.
But what do you do with it after you're better?
Yeah.
And like for your instance, it definitely would benefit because you can constantly use it at least a couple times a month to maintain your range of motion and pain threshold or pain tolerances and stuff.
Totally agree, but I would say this even more. The person that is not like me, that's not on a dirt bike, because when I'm on a dirt bike, I'm hitting a jump, and then I come up short or whatever. It pushes me through my range of motion to the nth, right? To past it, and I'll get what I call a stinger, and then I'm like, oh, but I'm okay. And then a lot of times, that's how I've done through all of my knee surgeries. I'll go out and ride, and I won't try to go full on, but I'll go a little bit, and just that little bit of bumping and stinger. The next day, as I've pushed past some range of motion, scar tissue that I couldn't do on my own, forcing it by that jerk on the bike. Well, how about the people that aren't still being active? They've got a knee replacement, and now they're just kind of, well, it's good, I can walk, and I don't have the pain I used to have, but they're still building scar tissue because they're not forcing themselves. So for someone that is more sedentary, that would be better for them because then they can sit there watching TV and they can crank that thing down and push it to where it starts to go, oh, that's my end point, and go a little further and hold it. I would say it would be equally beneficial, if not more, for the sedentary people or the people that aren't athletes that aren't doing something every day. You sit right there and you got it.